Today we will speak about an important aspect in heart development, that is congenital heart defect. Today we will speak about an important aspect in heart development, that is congenital heart defect. I think you all remember what do you mean by fetal circulation. You know all that in the fetal circulation or in the umbilical cord there are one vein and two arteries. We said before that umbilical vein carry oxygenated blood, which is about 80% oxygenated with oxygen, and the umbilical arteries containing deoxygenated blood. We said that umbilical vein with oxygenated blood will carry the blood from the placenta to the left branch of the portal vein. Most of this blood passes to the inferior vena cava directly through ductus venosus. Some of the blood which passes to the branches of the portal vein will reach the liver, and this blood will be collected by the hepatic vein also into the inferior vena cava. And the inferior vena cava now carries better oxygenated blood, which passes to the right side of the heart, from the right side of the heart to the right ventricle, and because there is connection between the two atria of the heart, the right and left atria by the foramen ovale, some of that blood will go to the left atrium, and then from there it will be pushed to the systemic circulation, and then it will be carried out in the descending aorta, which will be less deoxygenated blood, in other words, carried down by the two umbilical arteries back to the placenta. So let's go back to our lecture today, which is about congenital heart defect. What do you mean by word congenital? That word means these are abnormalities or cardiac anomalies arising as a result of a defect in the structure or the function of the heart and the great vessels, which is present at birth. These abnormalities can be either defected in the obstruct the blood flow in the heart or the blood vessels near the heart, or it alter the circulation that goes from the heart. So the end result or the sequelae or the complication on the baby will be as a result of these changes. Let's classify أو خلينا نقسم التايبس of congenital abnormalities of the heart. ممكن تكون هذه الابنورماليتي ممكن يكون البيبي كل شيء ما بي pink in color, but there is a truly cardiac abnormality. ليش يصير baby pink in color? Because there is changes in the flow or in the pressure over the heart or the great vessels, which will affect the baby. It will have a complication. Example of these abnormalities: atrial septal defect, ventricular septal defect, patent ductus arteriosis, and cortication of aorta. And we will talk in each one by one. The blue heart, the blue baby abnormalities, the baby will be cyanosed, يكون مزرق baby. Why? Because there is changes in the pulmonary circulation, which is either increase or decrease as a result of these defects. You know all, when the baby taking after birth, when he cry, he takes first breath. By this first breath, the pulmonary circulation will be opened, and there will be pressure, and there will be the blood which goes to the lung will be aerated or ventilated or will be full with oxygen. So changes in that circulation, whether in form of increase or decrease, it will result in cyanotic cyanosis of the baby. Example of these abnormalities: Fallot tetralogy, transposition of great vessels, or tricuspid atresia. طبعا let we talk now about first defect, which is atrial septal defect, ASD. شنو هي هاي ال ASD? It is abnormal opening in the atrial septum, which allows هسه احنا بدنا نحكي كلها after birth. طبعا before birth the right side of the heart هو dominate وهاي pressure أكثر من ال left side. ليش؟ لأنه أكوش opening وما pulmonary circulation. But after birth definitely the left side of the heart will dominate, the pressure is more, so the blood in the left side of the heart, or blood which returns from the lung to the left atrium, is well oxygenated blood because there is pulmonary circulation as there is a breath. It will be pushed from the left side of the heart to the right side of the heart. It will be mixing. The blood in the right side of the heart or the right atrium comes definitely from the superior and inferior vena cava. They will all be collected in the right atrium. So too much blood. The blood is coming from the upper and inferior vena cava from the left side under high pressure, because the left side is ventilated well, more oxygenated blood will be mixed with the deoxygenated blood. So there will be volume, and this volume will produce a much more pressure load on the left, on the right ventricles. So when we'll be pushed to the pulmonary circulation, it will be pushed because there is volume overload. Too much blood from the left side of the heart, from the superior and inferior vena cava. Too much blood in the left, in the right atrium, will be pushed. This volume overload to the right side, right ventricle. So there will be pulmonary congestion. Okay, and most commonly those babies will be having cough, rotative cough, sometimes even with hemoptysis, because there is high pressure in the pulmonary circulation or pulmonary congestion. Hemoptysis يعني يصير sputum with the blood, mixed with the blood. Hemoptysis, cough, قحة. And this abnormality is present in about 4-10% of the child with congenital heart disease. تقريبا حوالي 10% منهم هذول يكونون عندهم ASD, more common in females. طبعا هاي بس مجرد للاطلاع. احنا قلنا types of atrial septal defect. If you remember well the development of the heart, when there is atria and ventricle, there will be an atrioventricular septum. From the upper portion of the atrioventricular septum, there is some septum that growth of tissue which will goes upward. We call them ostium primum, and at the same time, and in the upper part, there will be another development, downward growth. They will meet together, leaving a very tiny structures. At the same time, with the development of this upper downward growth, there is another growth much more toward the left atrium, which we call them septum secundum. Gradually there is resolution of this ostium primum, the upper part, near the entrance of the great vessels and the right atrium, and the upper growth from the interventricular septum and the downward growth from the interatrial septum. They will grow towards each other, leaving a small opening or septum defect that is called a foramen ovale. This foramen ovale usually will close within 1 week after birth. It's gradually shrinkage in size till it will leave a very small tiny opening, which will be gradually decreased further in the growing month of the baby. But ideally the major closure will be occurred within the first week of development. Sometimes this ostium secundum will persist, which is present in about 50 to 70% of the atrial septal defect. There will be maintenance of this ostium secundum. Another groups of patients or babies, they will have resolution of the ostium primum doesn't occur completely, and there will be some of the major part of the ostium primum will persist, leaving an opening of ostium primum in about 30% of cases, and sometimes even at the site of entrance of the superior vena cava, there is a small opening are left there in the wall of the atrium, the right atrium, that is sinus venosus, which is present in about less than 10% of the cases. But the most of these cases of atrial septal defect are persistence of the ostium secundum. clinical presentation، يعني الأعراض السريرية لهذا الكونديشن. شلون يجي الطفل عنده ASD؟ مرات يجي most of cases يجي asymptomatic، ما عنده أي أعراض سريري، أو قسم مثلا ياخذ له وقت فد أشهر، يجوز مثلا 2-3 تبدأ عنده الأعراض. هناك مثلا تقول لك الطفل كل شيء ما بيه. ليش احنا قلنا تذكرون قلنا هي CYNOTIC heart disease، ال ASD، ال VSD، ال patent ductus arteriosis والcortication of aorta، قلنا كلها هاي baby will be pink in color so they are acyanosis. فمرات شنو ما تحس بكل شيء الأمية. الطفل يكون أشهر، يجوز عمره سنة سنتين، يقول لك بدأ يفحط، يتعب، يصير difficulty in breathing، sweating، palpitation، يعرق، خفقان يصير عنده، يتعب، يجوز يكون stunting growth، يعني نموه متأخر شوية، مو مثل أقرانه، شوية أقل من أقرانه، نموه بطيء شوية. مرات يقول لك يعني من يلعب ويا الأطفال أو يصعد درج أو يمشي الطفل يختنق. So الأعراض in general will depend on the type and severity of ASD. Abnormality after ASD is the VSD. Really, VSD are the most common congenital heart abnormality. If you have 100 babies delivered each year, 14 to 17% of them having VSD. إذا 100 طفل يولدون كل سنة 14 إلى 17 منهم دول عندهم VSD. شنو ال VSD من اسمها؟ Ventricular Septal Defect. There is abnormal defect or opening between the right and the left side. As we said, the right side is deoxygenated blood is there, and the left side is dominate post-delivery or post-birth. So the blood will be pushed from the left side to the right side. There is also volume overload, and to be pushed through the pulmonary circulation to the lungs, so there will be pulmonary congestion also. This diagram exactly shows you what's going on in the ventricular septal defect. How the blood is dominated from the brown left side to the blue right side. Now we will talk about patent ductus arteriosus. من اسمها patent ductus arteriosus. It is a duct that is patent between the aorta and the pulmonary circulation. Normally, following birth, it will be closed, but if there is failure of the closure of this duct, there will be persistence, or we call them patent ductus arteriosus. شو وقتها يصير؟ مع نعرف كلنا ان مدة الحمل كلها نورمالي 9 أشهر. مرات البيبي يجي قبل هذا الأوان بالسابع أو بالثامن فنسميه premature infant. مرات تبقى هاي يعني عندهم ما انسدد مثلا النورمال يجي ورا 9 أشهر. أو إذا بيبي صار عنده من mother صار عندها viral infection during pregnancy, virus infection روبيلا، ممكن يأثر على الهارت فيسوي persistence of this duct. فشي يصير إذا بقى هذا الدكت وقت مفتوحة، البلد اللي هو من الأيورتا اللي هو oxygenated يصير ديما يروح mixing ويا deoxygenated blood pulmonary circulation. المفروض ينسد هو هذا الأوبننج، بس من يبقى مفتوح it will be mixed, so also will be pushed pressure under high volume to the pulmonary circulation, and there will be pulmonary hypertension and congestion. This patent ductus also is there, so these babies with the pulmonary hypertension and congestion, the lung tissue will be inflamed and irritated. فمن سهولة من يكون جزء من الجسم irritation بي و inflamed من السهولة يصير بي infection. That's why these babies are more liable to get infective bacterial endocarditis. If we talk now about cyanotic heart disease, as we said before, cyanotic heart disease because there is cyanosis, and these defects are result from increase or decrease in the pulmonary blood flow, as we said before. So they can arise. ليش يقلل البلد flow لللنج؟ أما يكون أكو obstruction أو يعني بالdevelopment of heart، أو يجوز يكون في defect بالdevelopment يعني بالanatomical defect، أو يكون يجوز يكونوا في اثنيناتهم، يكون أكو defect بالdevelopment أو يكون defect function. Both of them راح تسوي لنا تأثر على pulmonary circulation. احنا نعرف من يروح blood through the pulmonary circulation it will be oxygenated from the right side of the heart. After birth the blood is deoxygenated يروح لللنج حتى يصير بيه aeration، يصير بيه oxygenation. If this goes without proper oxygenation, so there will be cyanosis. That's why the baby will be presented with cyanosis ازرقاق. مثل ايش هذه؟ two condition Fallot tetralogy و transposition of great vessels TGFV. The first cyanotic heart disease is Fallot tetralogy. It is a condition, it is a complex condition really of cyanotic heart disease. من اسمها Tetralogy of Fallot. Tetra means 4. There are 4 abnormality in this condition. There is ventricular septal defect, there is pulmonary valve stenosis, there is overriding of aorta. الموقع مال الأورتا بالنسبة للبلمونري صاير غير شكل، يعني يصير يغطيه بحيث يسوي يعني بريشر عليه فحتى يأثر على السيركوليشن مال الأيورتا. والابنورماليتي الأخيرة بيكوز إنه أكو عندنا pulmonary valve stenosis اللي هو وين صاير هنا بالرايت فنتريكل، فيحاول الليفت الرايت فنتريكل يدفع أكثر سيركوليشن، ما يقدر يفوت بالستينوز فالف، فشي يصير يكبر حجمه، يصير right ventricular hypertrophy. So there are 4 abnormality really in this condition. There is VSD, ventricular septal defect, overriding of aorta, pulmonary stenosis, and hypertrophy of the right ventricle. Diagram shows you exactly what's occurring in the Tetralogy of Fallot. This is defect in the right ventricle, VSD, between the two ventricles. There is pulmonary stenosis, and there is right ventricular hypertrophy. شوفوا thickness when يكون right ventricle is more work on it يصير hypertrophied, يصير thicker. فالwall مال right ventricle is thicker than the left side, and there is overriding of the aorta. الأيورتا موقعها غير شكل بعد تسوي pulmonary pressures. This slide show you exactly what I talked about. The real abnormality or the complex abnormality of the Fallot tetralogy. You have to know the details of what's going on, because it is very important, and sometimes baby cannot survive unless correction by surgery is done. It is one of the fatal condition. يعني fatal يعني the result will be death of the baby إذا كانت الabnormality severe. If you discover it early and you manage it properly, baby may survive. Otherwise, it is a fatal heart defect. Showing in babies with cyanotic heart disease Fallot tetralogy, the baby will be cyanosed, which will be evident on the bluish coloration of the skin, lips, nails, and nail beds in the fingers and the toes, especially when baby have any activity as crying or feeding, irritability, lethargy, reduced activity, fatigue, and breathing difficulty sometimes. The other cyanotic heart disease is a transposition of great vessels. Transposition means تبادل. Normally, the aorta is connected to the left side of the heart, to the left ventricle, and the pulmonary artery is attached to the right ventricle. In transposition, they are transposed, متبادلين الأماكن. That's why the baby will be blue in color. I'll show exactly what's occurring in transposition of great vessels. And finally, you are responsible about these 5 common abnormalities. You should know all what's going on, how the baby will be look, and what is the defect, the major defect exactly. And thank you.